If you're like most people who have suffered an injury, you have gone to the doctor and been told to rest, ice, elevate, and been given pain medication. You may have been sent to physical therapy, which has now left you feeling recovered, or you're still having pain and dysfunction. Hi, I'm Dr. Veronica Uknes, Doctor of Chiropractic and Doctor of Physical Therapy at Code V Performance. In the next 2 minutes, I'm going to discuss with you the critical piece that was missing in your care, which has either prevented you from full recovery or has left you susceptible to future injury and chronic pain. When you sustain an injury to a joint, some of the muscles around the joint become overloaded beyond what they can sustain. The nervous system then has two options. It can choose to inhibit the muscle or shut it down, just like tripping a circuit breaker to prevent overloading electrical components, or it can choose to let the muscle tear. Usually the nervous system chooses to inhibit the muscle. The critical component missing from your rehabilitation program was turning on or facilitating those inhibited muscles. This is the root cause of your slow recovery, your continued pain, lack of coordination, and inability to achieve maximum performance. At Code V Performance, we use a revolutionary advancement in sports medicine called Advanced Muscle Integration Technique, or AMIT. The AMIT method has been used for over 20 years successfully by Olympic athletes, professional athletes, and weekend warriors alike. Using the AMIT method, I am able to test over 600 muscles throughout the body and identify where your inhibited and weak muscles are. Here I am testing the glute max sacral division muscle of a young athlete. Notice how she is unable to maintain force against the resistance of my hand. This indicates an inhibited or weak muscle. Next, using the AMIT technique, I stimulate the attachments of the muscle as well as reflex points related to that muscle, chiropractic adjustments, as well as soft tissue mobilization to reactivate that muscle or strengthen it. Notice now how she's able to maintain significant resistance against the force of my hand. Inhibited or weak glutes can be big contributors to low back pain as well as decreased squatting and running performance. I will apply this method to the remaining inhibited muscles throughout her body, restoring strength and normal joint mechanics, thereby decreasing pain, allowing her to heal, and returning her to maximum performance. If you have been injured, visit us at codevperformance.com to schedule your new patient exam and find out how many muscles we can turn on for you.